Hello colleagues, I'm very pleased to introduce our recent study about the differences in removal torque between the post-use removal and the post-retention removal groups. I also thanks to Dr. Ho Jin Kim. He did a lot of work to analyze this data, and also thanks to the editorial board of KJO to give us a chance to introduce this article. As we know, the microimplant is used for many purposes, and it has profound effect, and it guaranteed a successful treatment. But in some cases, we found that some relapse. After that, we tend to keep the microimplant in the bone to use those as a retention device. But there is a concern that if we keep the microimplant in the mouth for a long time, are there any difficulties in removing the microimplant out? And also, what happened with the microimplant staying in the mouth for a long time? So we have used a very extensive number of microimplants in this study. Actually, I measured all insertion torque and removal torque for last 20 years. This is the sample was used in this study. As you see here, 1,800 microimplants were included in the study from the 491, and maybe two-thirds of the microimplant was excluded from the study because of inability to measure the insertion and removal torque, and because of many other reasons. Finally, 568 microimplants were included in the study from the 241 patients. As you see here, this is the distribution of the microimplants, and each length and each diameter, and the placement method and maxilla and mandible. And this is how we measure the microimplant. We have used the same machines and the same technique in all measurement for last 20 years. And the in-bone stay period of the microimplant in post-use removal group was 556 days in average, and the post-retention group, it was 1,237 days. So in post-retention group, we kept the microimplant in the mouth for 507 days in average after treatment. If we're looking at the removal torque, post-retention group has higher removal torque as compared to the post-use group. So it's 4.6 Newton centimeter. The male and female group showed a similar trend, similar results. And if we're looking at the age groups, the young age group has much higher post-retention, higher removal torque in post-retention removal group than the post-use removal. But old age, there is a differences not big enough to show the statistical significance, even though the removal torque in post-retention group was higher. So it means that with time we have higher removal torque in young patients. Bone remodeling is more extensive. Then with the time we have more higher removal torque. That's the trend we found in the study. And also, if we looking at the placement torque and removal torque, placement torque is much higher than the removal torque, and also it has wide range variations. So, but the removal torque is the torque value becomes smaller, and also there is not that much wide range. So it's a similar trend between in the post-use removal group and post-retention removal groups. But as I said before, the post-retention group has higher removal torque. But if you're looking at here, post-retention group, placement torque in post-retention group, the insertion torque is smaller than the post-use group. The reason is that we keep the microimplant in the bone in high angle, open wide case is to use microimplant as vertical control retention device for vertical control. So means that the cortical bone is thinner and less dense. But because of that, placement torque is smaller, but the removal torque become larger even though placement torque is small. That's the trend. We can say that if microimplant stay in the bone for a long time, we have higher removal torque. But the torque range is about 5 to 6, 7 newtons, so it is not too difficult to remove it out. So maybe we can conclude the study like this way. So the post-retention group has a significantly higher removal torque than the post-use removal groups. It's about 4 to 5 newton centimeter of the range. And the placement torque and the microimplant length showed significant positive correlation with the removal torque in the no-drill post-use removal groups, and unloading in-bone stay period and microimplant diameter showed a positive correlation with the removal torque in post-retention removal group and in no-drill and the pre-drilling method respectively. So that's the conclusion. So in summary, it's I can say one word. Even though we keep the microimplant in the bone, even after treatment, it can be removed without any problems. So it has a quite good range of the removal torques, means that we can use the microimplant as a retention device without any concerns. Thank you very much for your attention.